Welcome to everyone to this. This is our third webinar around nursing employment support webinar across the North Eastern Yorkshire. We have got colleagues here with us who will be presenting throughout the session. There is a chat option for questions if you want to pop that in there. Maybe wait till the end of the presentations in case your question gets answered. I'm Leslie Young. I'm one of the Senior Regional Nurse and Midwifery Workforce Leads with the Workforce Training and Education Directorate in NHS England. I'll test you on that by the end of it. And we've got colleagues here from primary care and social care, and we have got some slides from colleagues in health and justice as well, really just to look at those opportunities of the wider opportunity around roles across all health and social care. The webinar will be recorded. As I say, there is an option to put your questions in, and we can obviously share any information after that. There is our generic email box there. And if you have any questions sort of that come to mind afterwards, please do feel free to drop us an email at the North generic email address. So this is the agenda, which I can't see because it's way too small, Paul. So I'm just going to go through and invite our first speaker, Emma Thompson from General Practice, to share her slides and present around opportunities in general practice.
Thank you, Leslie. That's great. I'll share my screen now then. And it'll be coming up in a sec. Fingers crossed. Takes a little bit to load. Okay, so my name's Emma Thompson, and I'm the Nursing Director for the South Yorkshire Primary Care Workforce and Training Hub. And we sit alongside all the practices, the GP practices across South Yorkshire, and help support with training, education, and workforce support as well. So my background is that I was a nurse in secondary care and then came into general practice after that. And I want to talk to you a little bit about a first destination career in general practice nursing and debunking some of the myths around getting a job in general practice. So first of all, just to sort of talk a little bit about what is primary care, what is general practice. And primary care is really the front door of the NHS. So it consists of 4 components. So there's general practice, there's dentistry, community pharmacy, and opticians as well. And it's interesting to note that actually, when we say the front door of the NHS, we really mean that. So 300 million consultations happen each year in primary care across those 4 areas. This is compared to A&E, where 23 million visits happen. So quite a lot more than A&E. And this really is the front door into the NHS, and then people are referred from there, and their care is managed from there. So what is the role of the general practice nurse? And what does a typical day look like? Some of you might have been fortunate enough to have a placement in general practice. They're a little bit like gold dust. But to tell you a little bit about the role, so it's a very different way of nursing. I've nursed in all the different environments you can think of, and this is very different. It's very clinic based. You have a very privileged position of being in a patient consultation behind a closed door with somebody and talking to them about health promotion, literacy. You see somebody across the whole lifespan. So and you look after whole families. So you may, in one appointment, be doing baby vaccinations and checks on an 8-week-old baby. The next appointment, you may be seeing somebody for diagnosing COPD, doing spirometry. The next point, you may be looking after a young diabetic patient. The next appointment, you may be doing something completely different and looking at somebody who's come in for a diabetes foot checks and things like that. So lots and lots of different things that you'll be doing in general practice. You're very autonomous, and there's a huge variety of work that you do. And also it's worth thinking about the career progression you can have if you come into general practice. So lots of general practice nurses are prescribers, and then they can see a patient for a whole episode of care and prescribe for that patient as well if they need their hypertension medication changing during the consultation, things like that. They can really do the whole thing for that patient. So you get a really good degree of sort of satisfaction as a nurse as well, it's worth saying. People go on to do advanced practice from the general practice nurse role as well, or specialise within a certain area. So although you're in general practice nurse, you may think actually respiratory is really where I would like to focus my attention, and the practice agree with that, and you become a prescriber or an advanced practitioner within that area. So there's a huge scope for developing your role within general practice. It used to be back in the day that you needed a couple of years in working in secondary care before coming into general practice, and I know that that myth is still out there in some universities, and some people are still being told that is not the case now. Absolutely not the case. And I know that on some of the job adverts it says experience needed, but a lot of people are employing newly qualified nurses to be trained up as general practice nurses. So we've covered a lot of this already. A lot of the stuff is around health promotion, screening, cervical screening, managing disease, looking at the whole person health. And you're very much there walking alongside somebody in their normal life, as it were. They come in to see you as part of their normal life, and then you're walking alongside somebody in that. They're not acutely ill necessarily, but they need lots of information. You're walking alongside them in life. So thinking about getting jobs and applying for a practice nurse job. If you look on NHS jobs, some practice nurse jobs are advertised on there. It does, like I said, often say experience needed, but what I know to be true from talking to lots of nurse managers in general practice is that they're looking for the right person and the right fit for their practice. Their teams are often quite small, and they'd rather have somebody who is the right fit that they can train up than somebody who is very well trained but actually won't work well within the team. So please don't be put off by the fact that it says experience needed. They also advertise on other forums as well. So for example, Indeed, sometimes practice websites, sometimes local bulletins or local medical council bulletins. Sometimes it's just word of mouth as well. So I'd encourage you, if there's a practice that you are really keen to work at, contact the practice manager, ask to have a conversation, and practice managers all speak to each other, and if they haven't got something, and they may know something that's coming up as well. So you have to think outside the box when you're thinking about general practice nursing. I'm going to talk a little bit about applying, because it's slightly different, because I'm aware that lots of people don't have experience in general practice nursing, but maybe very enthusiastic to start the career there. I would say if you can do at your university or at a university near to you, they should be offering the CNO002 module, which is Discovering a Career in General Practice. If you haven't had a chance to do that, ask your university if that's available. If it's not available, you've done it or you have had a chance to do it, please do put it on your application form. It just shows that you've got a general insight into what it's like to work in general practice. And make all your experience relevant to general practice. That may seem like a no-brainer, but general practice is very different from working on the community, very different from working in secondary care. So if you can show that your skills you've got translate into general practice and you're aware of how that would work, that really will help you as well. What do you know about the practice? So doing lots of research around the practice, around the patient population, why are you applying to that practice as opposed to the practice down the road, and really doing your homework. That comes across hugely, making sure you've got good English and grammar. Sometimes the applications are slightly different. They might ask for a CV, they might not. Just make sure you're really doing what they've asked for. And then the key thing is to arrange an informal visit. And this is almost expected within general practice. If you're really serious about working in a practice, they all want you to have gone for a little walk around before to say, yes, this is the environment I'd like to work in, because every single general practice is a different business and they all work slightly differently. Some are huge, some are small, some have big nursing teams, sometimes you'll be the only nurse there. So you need to talk from an educated point of view about that particular general practice. So do contact the person who is advertising. There should be a contact there, and I'm sure they'll be happy to arrange an informal visit with you. And just be aware as well that that informal visit often is a little bit more than that. You should go thinking it's like a first interview. I remember I went for an informal visit for the first job I got, and they showed me around the practice, and I popped my head round the door where all the nurses were having a cup of coffee, and I got the job, and the nurses said to me afterwards, do you know that us after the interview, they asked us all, did we think we'd be able to work with you after meeting you? So just be aware that, you know, you are sort of being interviewed, and the practice like that, they like to see who you are, a little bit of a taste of who you are, and the fact that you've come for the interview after being there shows that you think you'll be a good fit for the practice as well. This it says just preparing for the interview. Again, informal visit, do a dry run of the route. This may sound simple, but just make sure you know where you're going to park, where exactly the practice is. Is there any problems with parking, so you're not late for your interview? And one of the main things is to scope out what practice nurse training is available in your area. And I'll put a link afterwards into the chat. So the training hubs, so there's a training hub in each of the 4 areas that we're covering with this webinar. And they will be able to signpost you to, or they run themselves, a 1-year program for practice nurses who are coming into general practice. So for example, in South Yorkshire, we run a program starting at the end of October this year. We've already got newly qualified nurses coming on it that have been employed by general practice to come and start on the program, and they will do a 1-year program, a day a week, upskilling them in all the different areas that they need for general practice. For example, smears, baby vaccinations, immunisations, sexual health, all those kind of things that you won't have had in your undergraduate training. Yeah, at the interview, arrive early. These are skills that you'll already know, but I think the main thing to say is show how your experience that you've had translates into working in general practice. You know, have you worked autonomously before? Are you good particularly doing the patient consultations, those one-on-one things? What do you know about working in general practice? What do you know about long-term condition reviews? How does general practice work? Just having that, being able to show that you are aware of what happens in general practice, knowing, for example, that general practices are all independent businesses. The terms and conditions and the pay will vary from practice to practice. So being aware of the landscape that you're coming into will help you at interview. If you're successful, absolutely, this is a time when they offer you the job that you discuss your salary, your terms and conditions. Sometimes you have to do a bit of negotiation. You're looking at maternity pay, sick pay, training, your working hours and your days. If you're unsuccessful, I'd always say please do ask for their advice of what you could do differently, and always be aware, especially in general practice, it is quite a small network, quite a small group of people, and they all talk to each other. So if you're not successful, but you ask for constructive feedback and you say, I am really interested in the job, do you know of any others that are going, the practice manager may well then say, oh, actually the practice down the road I know are looking for someone, or I'll put you on your name on file and get back to you. And it's unusual to get a job straight away in general practice, and sometimes people have to apply multiple times to get a job. So please don't give up. Do keep applying, and you know, I'll put my email address in the chat as well, and I'm always very happy if you want to email me, especially regarding the training for practice nurses that's available after you've qualified and after you've got a job. So Leslie, are there any questions in the chat? Should I have a little look? I'll just pull the chat
There's
up.
not that I can see, and you're absolutely right. practice managers do pass on CVs. That's how I got into general practice. I applied for a job, didn't get it, but they passed on my CV and I got the next role. Spent a long time in general practice as well. So I am a big advocate for healthcare roles and careers outside of the hospitals because it's massive. And Emma mentioned the CNO 002 discovering a career in general practice. I have put the link in the chat as well. And we've got 3 universities who deliver it locally, Sheffield Hallam, Northumbria and Teesside, and they all deliver it differently. So some of them are completely online, some of them are a bit of a blended approach, some are face to face. So, but there is that opportunity, and Emma's absolutely right to really undertake that opportunity, and that's for students, nursing students, nursing associate students, and registered nurses and nursing associates. So it really is something worth doing, and it will give you that insight and give you that little bit of an edge that Emma was talking about.
Great, thank you. Well, I'll keep on for another 10 minutes, Leslie. Just keep an eye on the chat. How long does the training take? Just to answer Princess's comment, is it takes a year normally to train to be a general practice nurse. You do that as part of your normal job, so you get a job in general practice and then you're released about a day. It depends on what's happening with the training in your area, about a day, a week, to do all the different elements of the practice nurse training that you need. But it's well established and well known within general practice. And if you can find out what the training is within your area, and then when you go for your interview, you've done your research, you say, yes, I know I'm really qualified, but this is a program I can go on to that starts at this time. That really ticks a huge box. So yeah, all the best, and do consider a career in general practice. Oh yeah, and mental health nurses, learning disability nurses, children's nurses and adult nurses are all able to apply for general practice nurse posts. All of those, all that training is invaluable in general practice. Thank you,
Lovely,
Leslie.
thank you. Right, I shall just once again attempt to share my screen. I'm not sure if anything's happening. I shall try again.
Sometimes it takes a little while to load, Leslie.
Oh, there, something's happening. Oh.
Nothing yet.
It's thinking about it, I think. Oh, did something happen there? Oh, something's happening.
Yeah,
something's
you're
happening.
on. You're on, it's good.
Right, I'm just going to put it on the other screen so that I can actually see it. So massive thanks to Emma. I'm just quickly flicking through those general practice nurse slides. Unfortunately, Chloe and Susie from Spectrum from Health and Justice can't be here with us today. So I'm going to try and go through their slides. Heaven help you. Just to give a little bit of insight into that. So Chloe Haig is one of the directors of nursing with Spectrum, and she was able to come to the first webinar. And really, as Emma's already alluded to, we're trying to promote those roles that perhaps people don't think of, trying to dispel those myths that you have to have a magical 2 years in a hospital before you can work anywhere else, which is absolutely not true at all. You can, if you decide that you want to work in health and justice and that's for your career, then that's where you can start your career. It's really important that we get that message out there that actually, it's about the opportunities. So Spectrum is a community interest company and a not-for-profit organisation. So any surplus fund profits they get, they put that back into initiatives and projects to support obviously health and well-being of their population. It is the second largest prison healthcare provider in the UK, and if you think about health and justice and healthcare providers and organisations, that is their home, that prison or that immigration centre or wherever these people are, that is their home. So they all have access to all of the same services that we would have in the general public. So they do run a primary care service as well, and the healthcare team have that sort of responsibility from reception to release. They do lots of things around health promotion, long-term condition management, wound care, inpatients, care and separation units, and thinking about all of that. Just because someone is within the health and justice system doesn't mean that they don't have all the health needs that we have as the general population. So it really is important that there's an equitable support service for everyone across wherever they reside. One of the big areas that they work around is sexual health, and there's a nurse-led, specialist nurses and prescribers, and really just trying to work into the communities as well to try and reduce things like teenage pregnancy, really promote sexual health awareness and resilience for the future generations. Community substance misuse is a massive part of their services, and again, this is often nurse-led with a lot of prescribers, and really looking at this in a holistic manner alongside those psychological therapies as well. Primary care, as I've said, they have primary care services within prisons, within immigration centres, and also some GP practices out in the population, and they're exactly as Emma's described. They offer all the same services as you would get in any primary care GP practice as well. They do offer a preceptorship programme, 12-month programme, 75 hours supernumerary. They get allocated a preceptor and they have a preceptee network. They have 14 prisons, 2 sexual health services and 3 drug and alcohol community services as well. So it is important that we sort of highlight all of the opportunities out there. Now, correct me if I'm wrong, Paul, but I think there is a link as well for vacancies to Spectrum and the health and justice system that Chloe's shared before. Am I right in thinking that?
Yeah, there'll be an additional information sheet that I'll send
right.
with a few different organisations with searching for vacancies.
Great, that's great. So again, once you get the information and the recording and the slides, Paul will be able to include that information as well. So you'll have the opportunity to look for opportunities within that health and justice system as well. I'm sure I haven't done that any justice compared to what Chloe and Susie would have done, but it really just to give you a flavour of that health and justice system and what that looks like. I'm now going to hand over to Nicola from social care, and who'll probably be much more articulate than I was.
Thank you ever so much. So my name is Nicola Greenwood and I am the locality manager for Skills for Care, and I work with colleagues across the Yorkshire, Cumbria and North East area. What I'd like to do for the next few moments is just share with you some insight into social care nursing, what it is, and hoping to dispel some of the myths that you may have heard about social care nursing. Next slide, please, Leslie. So, why social care? You will probably all understand that it is a fact that social care will impact on all of us at some point in our lives, whether it's for ourselves or whether it's for a loved one. And we have a responsibility to make sure that the support we provide to those individuals who need care is the best that it can possibly be, so that they can live their best lives. Next slide, please. So what do we mean by social care? Social care works within a model that aims to dismantle unnecessary barriers. It is about the support, health and care that we need to live our best lives, typically but not exclusively as we get older. For some people, we will need ongoing nursing care for conditions which do not require hospital stay, but for which we're not able to look after ourselves independently. So social care and nursing allows people to access that health and care support within their own home environment, whether that home is a home that they own privately or a home where they're living in another residence, whether that's a nursing home, residential home, or within a supported living service. Next slide, please, Leslie. So much like primary care, as Emma's explained, working in social care as a nurse, you would work very autonomously. You would be delivering person-centred, strength-based, collaborative care. You would support people with medium to long-term support needs. You would absolutely be enhancing the quality of life for that service user. And you would have the opportunity to manage both complex and long-term conditions. You would lead within that integrated team, and you would organise and manage service delivery, all of which you would do in other aspects of working in the health and social care environment. But within social care, you are you having that longer term relationship with people who rely on your nursing care. Next slide, please. So where do social care nurses work? You will possibly recognise some of the logos that we've got on the slide here. This is a very small number of the total number of social care providers that we have across Yorkshire, Cumbria and North East area. To give you a snapshot in terms of nursing providers, there are 372 nursing providers in social care across Yorkshire and Humber, 245 across the North East area, and we have 32 in Cumbria. So a total of around 650 social care providers within our region that provide social care nursing services. Next slide, please. So where do social care nurses and nursing associates work? Well, they can work in community care settings, such as care homes or domiciliary care. Home care or domiciliary care, I should say. They can also work within registered nursing homes, where they may support people with mental health problems, learning disabilities, complex needs, dementia, end of life, day centres and community-based services, all within the charity sector. So the whole range of opportunities and different services that support nursing within the social care environment. Next slide, please. So what nursing roles are there? Well, of course, there is the role of being a nurse within a social care setting, but there is a career opportunity working within social care. You can move on to undertake roles in research. You can become a clinical lead. You can become a day centre lead. You can become a deputy manager or a registered manager. There are also roles regarding learning and development, quality assurance and compliance, in addition to continuing to progress and potentially becoming a director within a social care service provider. Next slide, please. Is it a long-term career option? Absolutely, you would expect me to say yes. The strategy that Skills for Care launched with social care providers just over 12 months ago absolutely reinforces that nursing has a long-term future within social care, as we will see from the move from hospital to community. That reinforces the need for more enduring provision of nursing within community, primary care and social care. So yes, there is a long-term career option. If you can come next slide for me, please, Leslie. And here outlines some of the facts that we are due to have around that 32% increase in the number of people who will be aged over 65 by the year 2035. There will be 43% increase in the number of people who are living with dementia by 2040. There will be an increase in the number of people who have a learning disability, mental health or physical need over that same period of time. And by the time a person is 75, they are 60% more likely to possess 2 or more significant conditions. This figure increases to 75% as people age up to the age of 89. Additionally, forecasting done through Skills for Care has also indicated that we will need an increase of 29% more social care roles within the sector by 2040. Can now move on, Leslie. Thank you. One of the factors that we do know is that student nurses believe that they cannot work in social care as a newly qualified nurse. That is incorrect. You absolutely can, and social care does offer a preceptorship programme as well. So please don't worry if you are hearing that they only take nurses with experience. Times have changed and they do now accept newly qualified. Next slide, please, Leslie. One of the things we also hear is that, well, working in social care, I'm not going to meet the requirements for my revalidation. We can absolutely dispel that myth. The scope of practice that you will have as working within a nursing home or a social care environment will absolutely meet that scope of practice to successfully complete revalidation. You absolutely will do that. So please don't worry if you were to hear that it is a myth. You can absolutely have sufficient experience and knowledge to meet your revalidation requirements. Next slide, please. So where can you find jobs in social care? Much like primary care, working within social care is lots and lots of different providers that are different businesses, private businesses. So there isn't one job site like NHS Jobs that you can search, although there are some social care nursing jobs that do get advertised on NHS Jobs. But more typically, you find jobs on carehome.uk, Indeed, the government Find a Job website, or Total Jobs. There are some other advertising as well that local providers themselves might do, either on their website, or typically if they have vacancies, they might have a banner outside of their premises. So a tip: when you're walking around, when you're driving around, keep your eyes open for those opportunities for jobs to be advertised around you. Quite often they're on your doorstep, and you do need to keep your eyes peeled for them. But try and look through those jobs and keep persevering, because whilst there might be, if a provider says they haven't got a vacancy now, they may well have a vacancy next week, in a fortnight's time, because people do move around the sector to career progress. So do keep your eyes peeled for jobs. So next slide, please. What do people say about working within social care? And the next slide again, please, Leslie. This next slide that you see here just gives you a snapshot of some of the feedback that we have had from people that have taken on roles within social care, and the opportunities that has provided with them. Simon, I know Simon, he's progressed to being a deputy manager within a social care environment, absolutely thriving in that role. There is absolutely a career, a long career that you can have working within social care. The next slide, please. We also have a range of opportunities for social care nurses to engage. So we have our We Are Social Care Nursing forum that enables nurses across the country to come together. We produce regular newsletters, and there's local support from Skills for Care within your area as well. And there are other nursing forums and networks that you can join within your local community. Does anybody have any questions from me? I think there was one that appeared in the chat while I was talking, so I'll just go and try and have a look for that. There's go to Emma's. Just scrolling down through Emma's responses. So Sophie, yes, I will happily pop my email address in the chat. So if anybody has any questions that they think of after today's webinar, you are free to contact me. There you are.
Oh, that's lovely, Julie. Thank you very much, and thanks to Emma and for keeping on top of the chat there. Lovely. I shall. If there's no further questions for Nicola, we shall move on to Julie, who's here from the RCN, who's going to just give us some hints and tips about applying for our first job.
Yeah, thank you very much. I don't mind sharing my slides if it's easier for me to click through, then tell you next slide. Would you, or are you happy to click through? Or I can share.
Oh,
them
that's perfect, Julie. You can share your
Yeah.
slides.
Well,
do you know what I
hopefully
mean?
it'll work. Hopefully it'll work. Yeah, so hopefully you can see. Can you see those slides?
Yes, can see them.
Oh,
yeah,
fantastic.
Perfect.
Yeah, thank you very much. So yeah, my name's Julie and I work as a career coach with the RCN. So I just want to give you a bit of an overview really in terms of how we can help you if you are a member with us. And also I'll give you a couple of tips that you can go away with just in terms of applying for jobs and interviews and that whole kind of process. Everything that we speak about today is online. So there's the direct email address. So it's rcn.org.uk/careers, and it'll take you directly then to our main landing page. So I'm going to go through some top tips with you. As I said, it's a quick overview, but I want you to also be able to go away with something that you can apply today or tomorrow. So we always say, get your CV ready. As you heard from Emma at the start, particularly practice nursing, general practice, CVs, if you've got that ready, it just makes it so much easier for you. You can look at our online advice and guidance. So go to that main landing page, and on there you'll find how to write a CV, what you need to include in terms of the structure and the layout. You find sample CVs as well, and also some webinars that will talk specifically about writing and creating your first CV, and that's something you can do now if you haven't already got one. We've also got a CV check-in service. So if you're a member of the RCN, you can email that through to us. We can give you some email feedback on it. So again, utilize your membership if you are members. Let me just go next. Oh, my screen has decided to freeze. There we are. Should be okay now. Another kind of tip, when you are creating that CV is just to make sure it's on 2 sides of A4. We get lots through that, perhaps on 5 and 6 pages. What happens then is all the important bits can get lost. Make sure, I think, again, it's been talked about today, you want to draw upon the relevant skills. You always want to tailor your CV to that job and to that advert. So pull out, well, what's going to be appealing, what's going to be relevant, and what might impress this particular employer. Where are my transferable skills over? You've got then your supporting statement. So this is different to a CV and people can sometimes get confused. This is the most important part of an online application. So it can be a supporting statement, supporting information section. So that's something you can go and have a look at the technique now. You can learn how to write a good supporting statement, and you can do that now. Familiarize yourself with the person's specification, the job description, organisational values. The person spec will be the key document when you're writing a good supporting statement. And don't underestimate how long it can take. Once you've done one, I think it'll get a bit easier, but make sure you give yourself plenty of time. It is competitive at the moment. Have a look again. We've got online advice. We've got a sample supporting statements, a tutorial, and similar with the CV, you can email us your supporting statement along with the job description and the person spec, and we can give you some email feedback on that as well. So some of the most important practical tips, when you're writing a good statement, it can feel overwhelming. So we always say, try and break it down. So you put it into three parts. So you've got an introduction, you've got a main body. So the main body will be that essential criteria and addressing that. And then you've got a conclusion. People forget an introduction sometimes. You always think of it, you'd introduce yourself. If you've met somebody in person, do the same. It just starts it off nicely, why you're applying for that job, making sure you're mentioning the field, you're mentioning the employer's name, the trust, all of that will go into that introduction. Then that main body, you're going to be addressing all of the essential criteria from the person's spec. It's not a cut and paste. You're going to make sure it's relevant and it's the same order to that job. You also want to make sure you've researched the job and the employer. How can you echo that you've done a little bit of homework on them? And then make sure you're giving examples. So relevant real life examples. You can use the CAR technique as well, because some people get a little bit stuck on how to evidence examples in a supporting statement. So the CAR technique can help. Here's a short example then for that. So the C is the context, the A is the action, and the R is the result. It's similar with STAR, which I'll touch upon now at interview, but this can just help you when you're writing your supporting statement, just to make sure you're evidencing it. So you give a little bit of context. Here you're working on placement. This is who I was working with. This is my action. So how did I contribute to working within the MDT? I looked at the patient, looked at engagement activities, response to medication, and then the result. My input helped inform care planning, guiding changes to the patient's routine that improved their well-being. Your examples will look very different. This is just to give you a flavour. If in a person's spec it says, essential criteria, working within the multidisciplinary team, then this is an idea of how you evidence that, and it'll be unique to you. And then hopefully, once you've written a good CV, a good supporting statement, you'll get to that interview stage. Again, go back onto our online resources, because we've got so much information there to help you. We've got sample interview questions. We've got another webinar that's online. We also offer one-to-one telephone interview coaching for RCN members. So you could ring RCN direct, email us a copy of the job details, and get that booked in. Practice the STAR technique and think about your STAR examples. So at interview, this is where you'd use the STAR. On application, you've got that CAR, and then this is the STAR. And it can just help sometimes to structure by using some of these techniques. So the S is the situation, what was going on, where were you working, you're just giving a bit of context. The T is the task, what did you need to do, what was your target, what was your goal. The A is the action, this is what I actually did, and R is the result. So this might be an example. If you've been asked, how do you prioritize your workload? So again, you can break it down. So you give them a little bit of context. I was working on this placement in this field. We supported a nurse with multiple patients. So again, it's just setting the scene for them. I like to think of it. So the task, this is what I needed to do. This is what my goal was. She wanted to ensure all patients receive safe and timely care while managing own delegated tasks. So this is the A in the action. This is where most of the writing, most of this talking and what you say in interview rather than will come into play is on what you did. So it talks about assessing who required the urgent care first, and then talking about how they assess that, anytime critical medications. They talk about organising routine observations, documentation and priorities, whilst also communicating with my mentor. Then what was that result? So it ensured all patients received appropriate care promptly. And again, it's nice if you can give a little bit of feedback from any peers or mentors. They praise my ability to think ahead and remain calm under pressure. So this just gives you, again, a little bit of a snapshot in terms of how you can use a STAR technique to provide evidence in terms of your examples at interview. So just some other tips to help you to stand out. Join RCN forums. They're a fantastic resource. You can link in with experts within that field. So if you want to know something really specific about a particular field of nursing, join the forums and you can ask there. It's good to network as well. You can gain an insight, again, if you want to know a bit more about a particular aspect, how does this work? I don't know, working in the community, what type of roles are in the community. You might want to join the RCN, district and community nursing forum then just to get that bit of an insight. You're going to want to research the roles, the employers, and the values. Check the job adverts, job descriptions, person specs carefully. Make sure you know what that job is about and what the expectation is. Look, are they running any initiatives? What services are they providing? All of this can help you with your application and interview as well. It can be quite impressive if you can talk about, oh, I've noticed that you're running this initiative. Can you tell me a little bit more about it? Know what their employers' values are. That's usually part of their interview process as well, and any kind of visions that they have as well. And I'll only briefly look at this because I know that Emma did such a thorough job earlier around informal visits. It's fantastic. Do it. I think some people are apprehensive. It's a really good way to create that good first impression, and it breaks the ice. You can instantly get a bit of rapport. If you struggle with interview nerves, again, having an informal visit can help with that because you're probably going to meet somebody who might be on the panel. It'll give you an insight into the role, so you've got a really good understanding of what would be expected in that role or that workplace. And again, it can just help you with your application and your research. And then this is what we can help you with, as a member. We've touched upon some of the email feedback. So that's an email service on CVs and supporter statements. We offer telephone career coaching. So these are all, one-to-one sessions. If you're feeling a little bit stuck or you're not sure what to do, again, career coaching might be able to help you with that. You'll always have to come prepared. We can't tell you what to do or research jobs for you. But if you've got any kind of obstacles or you're feeling just, oh gosh, I don't know which way to turn, then we might be able to help you with that. And then we've got telephone interview coaching. It's one-to-one, and it's an opportunity to practice questions and answers, to rehearse that. And we can give you some feedback then on how perhaps to enhance some of your answers. So there's the reminder of the website address again. And that's the direct email address if you wanted any further kind of information, or if you had any further questions, you can email me on that email address there. So it's career.service@rcn.org.uk. Okay, thank you. So I think if I stop sharing now.
Yeah. Oh, thanks, Julie. That's
that
great.
okay?
And absolutely highly
flew
recommend
through
the
it.
STAR technique. No, that's fine. Having been on both sides of the table a lot in interviews, being interviewed and being
Yeah.
the interviewer, I have found the STAR technique to be invaluable because I absolutely hate in being interviewed. So
Yeah.
it's sometimes you have a come out, and I think this has probably happened to us twice in my life, and both times I did get the job, and I thought, oh, I did really well there. But
Yeah.
I just, for people to realize that it's, everybody feels like that as well. But something
Yeah.
like the STAR technique really keeps you on track and keeps your focus going. So absolutely
Yeah,
can't
helps with the nerves.
yeah, definitely.
Yeah, brilliant.
So thank you very much. I don't know whether
Oh,
we've got
thank
any
you.
questions in the chat. No, I think if there's no more questions, and I think Emma and Paul have been going through and answering them, then we'll draw the session to a close. Yeah. So thank you very much for everyone attending. Massive thank you to our speakers. I'm sure I didn't do Chloe and Susie's slides any justice, but as Paul said, you will get some more information. Does anyone know anything about the news that was released yesterday? Probably know as much as you do, Sophie, so that there will be some additional funding to support new roles for graduates. That's as much as we know at the minute. Obviously, the announcement only came yesterday, so like everything, we'll be waiting for the detail behind that. But I really would. I am a massive advocate for health and social care opportunities outside of the hospital gates. So do sort of spread your wings and think about those opportunities as well that we've heard about today. But as soon as obviously we hear any more, then we'll get some more information. Unless, Julie, you've got any more information from an LCN side of things, but we haven't got the detail of how that's going to be enacted as yet.
I've popped the RCN's update. I've popped it in the chat.
Oh, thank you.
Everybody
Yeah.
can have a little look at that as well.
Yeah, great.
Okay, thanks.
But yeah, lovely. Thank you.